Fundamental question 4. 1. A nurse is evaluating the status of a client experiencing dyspnea. The nurse is aware that which of the following factor will decrease the work of breathing for this client. 1. Increased mucus production. 2. Interstitial pulmonary edema. 3. Bronchospasm. 4. Bronchodilation. Correct answer is 4. Bronchodilation. 2. A home care nurse provides medication instruction to a client. To ensure safe administration of medication in the home, the nurse 1. Demonstrate the proper procedure to take prescribed medication. 2. Allows the client to verbalize demonstrate correct administration procedure. 3. Instruct the client that it is okay to double up on medication if a dose has been missed. 4. Conducts pill count on each home visit. The correct answer is 4. Conducts pill count on each home visit. 3. The nurse is caring for a client with impaired mobility that occurred as a result of a stroke. The client has right side arm and leg weakness. The nurse would suggest that the client use which of the following assistive device that would provide the best stability for ambulating. 1. Crutches. 2. Single straight leg can. 3. Quad can. 4. Walker. The correct answer is 3. Quad can. 4. A nurse is instructing a client in diaphragmatic breathing. The nurse teaches the client that this technique helpful because in normal respiration as a diaphragm contracts it. 1. Moves downward and out. 2. Moves up and inward. 3. Makes the thoracic cage smaller. 4. Aids in exhalation. The correct answer is moves downward and out. 5. A nurse is planning to obtain arterial blood gas sample from a client with chronic obstructive pulmonary disease. The nurse plans time which activity after the arterial blood glucose drawn. 1. Holding a warm compress over the puncture site for 5 minutes. 2. Applying pressure to the puncture site by applying 2x2 gauge for 5 minutes. 3. Encouraging the client to open and close the hand rapidly for 2 minutes. 4. Having the client keep the radial pulse puncture site in a dependent position for 5 minutes. The correct answer is 2. Applying pressure to the puncture site by applying 2x2 gauge for 5 minutes. 6. The nurse is instructing the client who had a stroke how to ambulate using can. Which one following instruction would the nurse provide to the client? 1. To hold the can on affected side. 2. To hold the can on unaffected side. 3. To move the can forward first alone with the unaffected leg. 4. When going downstairs to move the can and the unaffected leg down first. The correct answer is 2. To hold the can on the unaffected side. 7. A nurse is reading the chest X-ray report of a client who has just been intubated. The report states the tip of the endotracheal tubes lie 1 cm above the crania. The nurse interprets that the tube 1 is positioned incorrectly. 2. Require repositioning. 3. Is positioned above the perforation of the right and left mainstem bronchi. 4. Is positioned above the first tracheal cartilaginous ring. The correct answer is 3. Is positioned above the right and left mainstem bronchi.